Subacromial injections are performed for subacromial impingement syndrome, rotator cuff tendonitis, especially supraspinatus, subacromial bursitis, and for aspiration of the subacromial bursa. Have the patient sit at the edge of the bed with the arm hanging off the side. This will help to open up the subacromial joint space. For the posterior approach to subacromial injections, palpate the acromion process. Identify the posterior border and the posterior corner. The entry point for the injection is about 1 centimeter below the posterior border and about 1 centimeter medial to the corner. Using a retractable pen, mark the point for injection. These injections should always be done using sterile technique. Scrub the site and then clean in an outward fashion. Here I am using betadine and following this with isopropyl alcohol. A no-touch technique is used, meaning that once the site is cleaned, it must not be touched with anything but sterile needles. Here I have a 22 gauge 1.5 inch needle with the bevel facing upwards. I will inject a mixture of 60 milligrams of depomedrol and 2% xylocaine made up to a volume of 5 mL. Advance the needle through your mark, aiming anteriorly, medially, and superiorly towards the underside of the acromion process. Advance it to about 3 centimeters. Always aspirate to ensure that you're not in a blood vessel, then inject the solution. This should go in freely. If there is any resistance, withdraw the needle and adjust accordingly. Remember to immediately apply the safety mechanism. Dry the site and then apply a bandage.